Hi everybody, my name is Dr. Ruth Souza. I'm the Research Stream Leader here at CEH, Centre for Culture, Ethnicity and Health. I want to talk to you a little bit about a project we've been doing about digital health technologies. What we've been interested in is how do people from migrant and refugee backgrounds use technology. There's a kind of a fantasy or an idea that people from refugee and migrant backgrounds don't engage in technology, and yet we recently did a focus group with pregnant and postnatal women from refugee and migrant backgrounds who said they never left home without their phone. So what we wanted to know is what they thought about what happens to all the information that's collected from their phone and their electronic health records. So what we did for this project is first we made boxes. These are data boxes, and these are known as design probes. So we're wanting to look at how do people engage with objects and things rather than just sitting around and having a conversation about them. We wanted to have a sort of visual cue for women to talk about. So what we did was Debris Facility, who's a wonderful artist in Melbourne, provided us with some great materials, and we invited academics, our collaborators at the University of Melbourne and staff here at North Richmond to make these data boxes. They are all really amazing and beautiful. Let's start with Debris one. I'm going to show you a couple. Debris one's really beautiful, and what Debris done is they've got a very simple device for deciding who can access their health information. These beautiful pieces of gauze can be taken apart with a safety pin here, and then people who are gentle and careful can access their health information. It's quite beautiful inside and quite different from the outside, and Debris got envelopes for particular kinds of health information. This is a really stunning box. I really love it. I think what I love about these is that they're also very different. I'm going to show you a couple more. This one's made by Danny Butt, who's an academic at the University of Melbourne. His is very interesting. It just looks like a stone that you might have in your garden, you know, some paving. And what he wanted was something that looked very ordinary, that just blended into the environment, that people wouldn't even notice if they came round to his place. I really like this one by Chris Marmo, who's from Paper Giant, who's also a great friend of CEH's. And what he's done in terms of who can access it, he's got this very light piece of paper. Anyone can actually break into this box and take information in case of emergency. But he's also got some other protections that he's put on it. He's got a date for when it was last accessed, so he can keep track of when it was accessed. He's also got a place for a thumbprint for people that he trusts. But that could also change, so you know that's something that is flexible. And he's also got spaces in the bottom where information could come out and could seep out. There's information that's not too personal that he'd be happy to reveal. So I'm not going to show you all of these boxes, but you can see how absolutely beautiful they are. This other one by a staff member kind of shows that at different times her desire to share her health information might change. There might be times where she doesn't want to have access to her health information. She doesn't want to know things. She wants to share things or not share things. What we did with these boxes was we had a focus group with women, and we asked them who they'd like to have access to the boxes. You know, we asked them to choose one. They were all very excited about these boxes. And then we said, who would you want to be able to access your health information? Would it be okay for your employer, your bank, your family members? And the results of that focus group are coming out in an article we've got with Health and Technology. So we'll put a link up to that wonderful group that we had. And we're going to continue our work looking at how technology impacts on the health of people from refugee and migrant backgrounds. Thanks for listening.